Welcome to Speaking in Spoons, the Chronically Ill podcast, with your host, Christina Brookman.
Hanging out, on
the street, speaking of
same old
spoons,
days,
time to meet.
last week.
This is Christina Brookman, your host for Speaking in Spoons, with my lovely co-host, Dr. Strauss and Lexi, who were just doing an impromptu song for you. Would you like to do it again?
Not at all.
Because I thought it was entertaining.
No, I'll get the song and put it on the episode.
That's my favorite way to communicate, you guys. I'm sorry.
It's okay. We're both in crazy pain. So it's appropriate that this episode is about pain. Both Lexi and I were in the ER this week.
Yeah.
We've got our heating pads going.
Christina went, and then the next day I was like, oh man, maybe I should go. I want to be like Christina.
It was really bad because I couldn't walk, and I have great roommates though, and my aide is wonderful. She got the ER, and like every time I was getting moved, it's like screaming because it's like giant knives in my back, because my lower back went out, but then like my cervical spine is all messed up right now, my left shoulder. So it's just not good. And it gets to that point where you can't breathe, you can't talk, you can't think. And then, you get discharged and you're like kind of okay. And then you have to take the ride back, and then you get wheeled in, and like
the rides make you hurt.
It's
so
just
much
so
more.
awful.
Anyway, enjoy this
Anyways.
episode on pain.
Dave's like, I don't want to be here forever on the intro.
Oh,
Let's
God.
just do this.
We're having a long
getting
day.
off track. I felt like we were getting off track.
We're having another episode within the intro.
Nate is here to keep us on track. So my point is, we're doing an episode about pain today. We have some lovely guests, Diane, Ballou, and Crystal Foster, who have some experiences, a lot of experiences with chronic pain and acute pain, and have really chosen to take that and serve people and help people. So without much ado, on to our interview discussion phase. Hi, welcome to Speaking in Spoons. Today we have Diane Ballou, and of course it's again me, Christina Brookman, your host, and Dr. Strauss. Our topic for today is pain, and our guest today, Diane, has a lot of personal experience with that, and I wanted to have her share some of that with us today, because I thought it would be helpful for people to hear her story. And yeah, so Diane, can you introduce yourself and tell us why you're here?
I'm Diane Ballou. I'm from New York, but I live in Virginia now. And I have a long history of pain. I actually don't remember a point in time where pain wasn't part of my life. As a child, I thought everybody had back pain. It's just, I always had it, so I figured everybody had it, but I must be weak or something because it's bothering me. So I never told anybody about it. And then when I was in 4th or 5th grade, my knees started swelling and turning red and hurting. And I knew that that was something different, something new, something that wasn't right. So I spoke up about that. And then at that point, started seeing doctors, trying to find an answer. I started talking about my back and telling my parents about that. And And then when I was in 7th grade, found out that I had a spinal deformity that was causing my pain. We still didn't know why all my other joints hurt, but didn't find out about that until a couple of years ago. But I've also had several spinal surgeries, and I would say my worst pain ever was after my last big fusion.
Mm.
The pain was so bad, and it just didn't seem like it would ever end. And I mean, I was having trouble thinking and staying awake, and I couldn't move because it hurt, but I couldn't stay still because it hurt. So I
Yeah.
was writhing in the bed, and then I'd have my mom help me to the chair and then back to the bed. And I've always been a pretty optimistic person and love life, but the pain was so bad that I was begging the doctors and nurses to kill me. And of course they refused, which I'm glad of now. But
Yeah.
then I thought, through all of this crazy thinking, I thought I had a brilliant idea. They could put me in an induced coma. And of course they denied that too.
Denied that, yeah.
Um, and I have a past with Buddhism, and there was a woman who, she was a pastor, but she kind of knew about a lot of different religions and theories and everything, who worked at the hospital, and she came and saw me. And she had, I don't remember what, but she had some sort of pain disorder. And she showed me that she had a fentanyl patch. And she told my mom, you need to fight for her. You need to see if you can get this for her, because this is not, she can't go on like this.
Yeah.
So I got the fentanyl patch, and 2 days later went home. And of course, you can't live on that forever. Um,
Right.
what ended up happening was, several months later, after trying physical therapy and different injections and things like that, I finally ended up getting a pain pump, and it changed my life. While I'm still disabled, it made me be able to function in my home and be able to have relationships and um, go to the store and things like that.
Yeah, it's I'm glad that you brought that up because there's right now we're having such a controversy and there's been the opioid, you know, epidemic, but I think there are still people out there, chronic pain patients, and in acute situations too, where opioids and like pain pumps, patches, things like that are necessary. So, and this is something I've been struggling with too, is, and I'd love to know how this has worked for you with your do you have a pain management doctor with a contract?
Yes.
And for those of you listening that aren't familiar, if you're a chronic pain patient, there are pain doctors that you will sign a contract with. And they'll usually take urine samples ever so often, scheduled and unscheduled, to make sure that you're following protocol and not abusing the medication. And or taking anything you're not supposed to be taking on top of it.
And also that you
Yeah.
have appropriate levels of the medication in your system, so
Right.
you're not selling it or
Yes.
anything like that.
Yeah. And it also means it does make it hard because sometimes, like I had this problem last week, my pain doctor, I was at the level of pain where they're like, we want to make sure something's not wrong with your spine, go to the ER so they can check it out. So I go to the ER, they check my spine, there's no herniated disc. It's an acute flare up of my chronic pain. But it's also like the way they take images and stuff, they're not going to see if something is kind of sublux a little and is hitting nerves, or my pelvis is out of alignment because image that, and that's a lot. Like if your pelvis is, and mine is constantly going out of alignment, it hits nerves, and then like it takes your breath away. And but then they're like, well, we can't treat you, you have to go home and have your pain doctor do it, because there's that conflict of interest, which can be frustrating, because you're like, I'm throwing up, I'm defecating myself because I'm in so much pain and it's hitting nerves, like I need help. But anyways, because of the opioid epidemic and the realization that there were a lot of lies told by pharmaceutical companies to doctors and abuse going on there, over prescribing and patients and doctors becoming addicted, it has made it difficult for people in chronic pain to have access to opioids. And it also doesn't seem like there's really a solution for pain management other than like injections and things like that. And not everybody tolerates injections, and injections aren't good for every problem. So I'd love to know your history with medication, like the whole path of like of that, if you have any thoughts on that. Yeah.
Yeah, well, when I first started, when I had an injury in my 20s, I was doing what I loved. I was working with exotic animals. I was so happy. And then I had an injury. And I just wanted a solution. I didn't want medication. I wanted a solution. Fix
Yes.
me so I can get back to doing what I love.
Right.
Unfortunately, even though you could see on x-rays and MRIs and everything how messed up my back was, I was constantly labeled a drug seeker. And it's like, I never once asked for medication. I never once got medication. Nobody ever offered it to me.
Uh-huh.
So
You just
that
wanted a
I
solution.
just wanted a solution. It was like, just fix it. I just
Yeah.
gotta find somebody to fix it. And luckily I did, and I was able to go and get back to work for a number of years. Um, then the pain started slowly coming back,
Mm-hmm.
and I got a neurostimulator, which
Ooh,
basically
yeah.
sends messages that interrupt the pain signal. So you
Okay.
feel kind of like a vibration. Um, and it was amazing. It didn't completely get rid of all the pain, but I was able to move to the Caribbean and get a job and, live a pretty normal life.
Yeah.
And when I was back in the States, the first winter I was back in the States, I fell on ice and I hit that spot in my back.
Yeah.
And I had to have a bigger spinal fusion, and they had to take the neurostimulator out in order to do it.
Oh, and could they put it back in, or?
They tried to
Okay.
put it back in, and there was too much scar tissue, so I didn't feel it in my back at all, and my legs would jump. And that was after the surgery where I was asking to die and everything,
Yeah.
that got taken out. But I was tried several things before getting the pain pump. I tried doing the neurostimulator. I actually tried two different neurostimulators, and injections and facet blocks and a whole bunch of things to try and fix it. Because I wanted that fix to
Yeah.
get everything to a place where I didn't have to be on medication and everything. But it just wasn't able to be repaired.
Yeah. And a lot of people that I've met online or talked to that deal with chronic pain are not seeking drugs. They're actually trying to avoid that, like you have said. But sometimes, in some cases, there isn't another answer yet. And maybe there will be someday. Hopefully, there will be someday. And maybe they'll
Right.
come up with better medications opposed to narcotics. But I my hope with this episode is that we can reach people in chronic pain who can hear this and realize they're not alone, but also maybe loved ones and practitioners can hear and listen to us and realize there is a whole community out there that are not drug seekers. They just need help. And we need better research into new plans for how to achieve this fix, this solution. Because like Lexi was talking about last week, we're still very new in science, you know. Some of this is very new. How would you say that pain disrupts your life? Because I know it's different for everybody. So, and for you, are there different types of pain, and what are those like? You know, because I know I get muscle pain, I get joint pain, I get nerve pain, and they're all different. So when people ask me what a 10 is, a 10 for one is different than. So I'd love to hear that from you and your
like a 3 or 4 is good for me.
okay.
But my 10 is begging to die. So
Yes.
it's a really broad range.
Yes.
And I have like a constant ache that's always there in my back.
Mm-hmm.
And then I also have problems with my neck that comes mainly from muscle, but the muscle impinges on the nerve that
Mm-hmm.
runs down my arm.
Yes.
So I get like nerve pain in my fingers where it feels like I've just put my hand on a hot stove. And if it's really bad, I can't use my arm. And I had to, in the spring semester, I had to use my accommodations at school because I had to write a paper and my hand didn't work. It didn't hurt, which was good, but it didn't work because it goes through a cycle where it hurts, it hurts, it hurts, and then it doesn't hurt anymore, but it can't. But I have like aching joints. I have really sharp pains in my back that kind of come and go. That ache is always there, but the sharp pain kind of, it travels to different spots, and sometimes it's worse than others. And I get pain from my hips that run mainly on my left side, that runs all the way down my leg. And movement, like walking and everything,
Uh-huh.
helps it. Unfortunately, I also have pain from my sacroiliac, which is basically the middle of your butt.
Yeah.
And it runs around what you think are your hips, but like your side and everything.
Right.
And that kind of contradicts the hip pain because movement hurts that. So it's
Like
like
the
I
one thing
move
that
for my
helps
hip.
one. Yeah.
Yeah.
Yeah. I think
But
that's the way for a lot of people out there too, with some of these complicated and complex. And people are like, why aren't you moving? And you're like, well, this other thing is preventing that. Have you, uh, when you're at your worst pain, is there something that works for you that helps you through that pain that you,
when it's the absolute worst, I do what I call my escape sleep.
okay.
And I get in bed and I get as comfortable as possible with propping different parts up with pillows, and basically just concentrate on my breath, and
Okay.
that's it. Just my breath.
Just your breath.
Just my
Yeah.
breath, nothing else. And we'll fall asleep, we'll wake up again because of the pain, and just concentrating on my breath in order to fall back asleep.
Yeah.
Slowing it down, like trying to like really
Like
Slowing
deep breathing.
deep
breathing
breathing kind of thing.
deeper,
I've
and
noticed like,
sometimes even putting like a sound in my exhale.
okay,
It's kind of
Oh,
like
like
the
like a
sound of the,
humming kind of
like
thing, or
yeah.
yeah, okay. They're like different noises and just holding that sound.
Yeah,
I've
on the
noticed, Diane,
exhale.
I don't know if just paying attention to my breath while I'm doing that, it gives me something to focus on other than the pain. And that it does, is that help you like when you're in this concentration of it almost becomes meditative, I guess,
And it
Yeah.
in
is
a way.
meditation. It is
Yeah.
literally meditation.
Nate is such an expert on meditation, and I always think I'm horrible at
Yeah.
that. Now I think maybe that's something I do in
No,
my
I mean,
own.
focusing on the breath, being present,
Yeah.
that's all meditation is. It's not a fancy thing. It's not some special
Ah,
do. You're just in the moment.
okay.
That's all it is. You're not thinking about the future. You're not worried about the past or worried about, well, what that, worried about the future, thinking about the past. Like you're not doing any of that. You're just thinking about breathing in, breathing out, slowing down. Your body switches to a parasympathetic mode, rest, digest, and you fall asleep.
Yeah.
You're,
I
you're
had a massage yesterday, and the masseuse was talking about you guys might love this. I'm so excited to try this. Like this woman does bowls, and you can fill them with liquid and stuff, and the sounds like, and she said she could put them on my chest and different parts of me, like during the massage and the relaxation, and like different levels of vibrations and sounds can help with that relaxation and that the pain and all of that. So,
When I had my first spinal fusion after that first injury,
uh-huh.
um, some things didn't go according to plan, and I wound up with compartment syndrome in my leg, and the toxins went to my lung and ended up needing to be on a vent. And they had a Buddhist monk come and visit me. I don't remember this at all. I was unconscious for
Yeah.
a week and a half. But my mom was there the whole time, and she said whenever he came in and would start doing the like chanting, singing type thing, all of my blood pressure would come down, my respiration. She could see it on the monitors.
That's
right.
really
Uh,
cool.
yeah.
That's really amazing. If you could give any advice to uh, loved ones when they have someone with chronic pain in their life, what do you think that might be?
Don't judge. Don't don't judge the person as a failure or trying to not function in life, like people think that you're faking or that you don't want to work or
Being
you're
lazy?
you're
Yeah.
lazy and all of that. And I would say just don't judge. Try and understand. Do some reading. Listen to podcasts like this.
Mhm.
Um, and also listen to your loved one. What they're telling you is their experience.
And their experience is valid.
Definitely.
Yeah. And if you could give advice to the medical professionals out there when dealing with people with chronic pain, what would you say?
I would basically say the same thing is
Yeah.
listen and truly listen to the
Hmm.
story. Don't make a judgment, like rush judgment on that they're looking for drugs or, listen to the story and listen to what they want.
Okay.
Like when I was being labeled a drug seeker, if you had listened to me, you would know that I never asked for a medication. If you
Right.
look through my chart, you would know that I was never given pain medication. If you listen to me, I was doing what I loved and I want to get back to it.
Right.
Just listen.
Yeah. And this is a similar question, but if you could give advice to people out there going and dealing day to day with chronic pain, like you have, what would you say?
I would say find something that you enjoy doing, even if it's a sedentary activity. When I was in so much pain, I mean, because you can't always sleep escape.
Yeah.
There's only so much your body will let you do that. And also you want to still partake in life. And I started beading because it was something I could just do with my hands. I didn't have to
Mm-hmm.
lift anything or do movement or it was just something so simple with my hands that could take my mind away from the pain for a little bit, and just
Yeah.
kind of make something pretty and, so I'd say find something that you enjoy doing that you can do.
Okay.
Um, and also find something like meditation or sleep escape or something like that for when it gets really bad. So you know how to calm yourself so that you're not getting panicked. Because
Right.
you can really make yourself a lot worse
By
when you start
panicking.
getting, you tense up all your muscles, which
Yeah.
they start hurting, and that'll make your nerves hurt and everything else. You
Mm-hmm.
have to learn how to relax.
It's a vicious cycle. Yeah.
Right.
Is there I know this. I'd like you to share with our listeners a little bit, how much ever you're comfortable sharing, but kind of what you used to do, how pain has changed that, and how you're working on your new future and why.
Um, all of the only thing I wanted to do since I was little was work with animals. And I was doing that. I was a veterinary technician. I did zoo work. I did wildlife rehabilitation, but it's all really physical work.
Mm-hmm.
Um, and when all this was happening, I couldn't even do a desk job because even just sitting was too much. But um, there was no way that I would be able, even with my pump and everything, to go back to animal work. I didn't think I would be able to do any type of work, and I'm still unsure if I
How
will
it'll,
be.
yeah.
But I'm taking through new treatments and new diagnoses and a lot of physical therapy. Um, I got to a point where I went, if I'm doing the right thing, maybe I can go back to work. Um, and I still wanted to do some sort of helping profession. And since I can't work with animals, well, how can I help people? And in a way that I can be, sitting, but also move around some, not be totally sedentary. And I just thought, what if I did therapy with people? I could help so many people. One thing that I would love to do is help people who are newly disabled kind of go through that mourning process
Yeah.
and look to life to, well, my life might not be the same, but it can be equally as good. It doesn't
It doesn't
necessarily
have
have
to,
to be bad.
yeah, it hasn't
Um,
ended. Yeah.
and excuse me, um, also LGBTQ people and just helping people. So I decided to go to school. I figured school is, first of all, will get me sitting at a chair, will get my mind more active, um, and it will kind of build up to a job because I know I couldn't just go work. My body
Right.
wouldn't let me. And I started out taking 3 classes, and within the first 2 weeks, I was in so much pain. So I dropped down to two. And sometimes I have to use my accommodations, but that's what they're there for, as you help me with
You're
using it for
such
the first time.
Well, you're such a good you've become such a good advocate for yourself. I know that was really hard for you to say, yes, I need help, or yes,
Yeah.
I can't do 3 classes. I have to drop down to 2, but that's taking care of myself so I can do this journey. And like you're
And
killing it.
you help me to do that. And I start field placement on Monday. And back in the spring semester when I was interviewing, I made sure to sort of come out to them as disabled. Because if a place isn't going to accommodate me and
Yeah.
isn't going to be understanding, then that's not the right place for me.
Yes.
And she was amazing. Normally they want people to do 7-hour days.
Uh-huh.
The school does.
Right.
But there's no way I could go from not working at all to 7-hour days, even
That's a
if
lot.
it's only 2 days a week.
Right.
So I'm going to go more frequently for shorter periods of time, and I okayed it with the school, and
Oh, that's so good. That's wonderful. I'm so excited for you.
thank
I know
you.
this is the big step.
Yeah,
So
it is.
yeah. And think you could do pain therapy too. You could also do, because I didn't know that was a whole field. I've been trying to talk to therapists who specifically specialize in dealing with patients with chronic pain. Um, and I was like, that's interesting. And, like therapy animals. You just got so much knowledge and life experience to help people. I think that's great. Do you have any questions, Dr. Strauss?
Oh, me?
Yeah.
Well, I liked what Diane said about using, because I can't prescribe drugs. So I like anything you can do for pain that has nothing to do with pharma. Not that you shouldn't do pharma, but things you can do before pharma or with pharma, I think are wonderful. Like so many, like for my pain, like I don't have chronic pain, but I do get pain every now and again. What helps me the most are just simple things I can do before I have to take something for it. Like you can positive attitude, breath work, acupuncture.
He used to do like daily affirmations. Is that you were doing like
I still do them. You can
yeah.
actually find them with your meditation. You can think, like what I'm doing now is I pick two things that I want to manifest, whatever that means, just like two things that I think are attainable. They can't be, I personally, I don't think they can be, big, huge things you'll never, like, I can't say, I want to run an Ironman. Like, I could say that to myself, but there's no way I can manifest that because it's too big. But just like things you can see yourself doing, I think if you just take 10 minutes out of your day to just think about those two things, maybe do some breath work while you do it, but just be quiet, think about those things, try to imagine them as real. Just for 10 minutes a day, I think it puts you in a positive place. And I think you're less in pain because you're feeling better and you just more I think that's beautiful that she did the sleep thing, the sleep escape. I think that's something that people need to learn, that there are other things you can do for pain that aren't just taking drugs. It's like
It'd
not
be
not
cool.
against drugs, but I'm just saying there's things people can do in addition to.
Yeah. They go together, like it's a
They can
yeah.
synergistically they can help you.
Yeah. Like I think that's so amazing. They brought in like um the Buddhist monk, did you say it was a monk?
Yeah.
Yeah, and wouldn't it be cool if like every hospital had a Buddhist monk or like some kind of energy worker or breath work like to
Yeah,
help?
they actually didn't. They had like a they had a Christian pastor or minister or something, and they had
Mhm.
a rabbi, but
Okay.
they actually brought him in from a local temple. Um,
Uh-huh.
it wasn't something that they had at the hospital, but they brought him in for me. My mother asked for it.
That is so
They,
cool.
something else I wanted to that when Nate was talking, I thought about is also think about if you can heat or cold, because those
Hmm.
things can
Yes,
be
yes, yes,
really
yes.
therapeutic.
Mhm.
And for my back, cold is terrible, but
Yeah.
heat is, I mean, it's like,
Yes.
amazing, can bring me so much relief. But when my knee is hurting, because I've done physical therapy, well, then I need some ice, and then the next day, heat might help. But so those are things that can really sort of add on to whether you're not taking meds or you are, they can sort of boost whatever you're doing already to help relieve pain.
Thank you, Diane. I'm so happy you came here with us today. And is there any last thing you wanted to say, or Nate, anything you wanted to say?
Well,
No, I
I
just,
would advocate for a cold shower. I personally hated cold, but then I started doing the cold showers and now I love it. It's weird. But I mean, if you can't handle it, then don't do it. But if you feel like there's any, because I think the cold and hot work so well together because cold shrivels your like makes your all your blood vessels in your body contract, but then you add heat and heat lets you relax. And if you do them both, you're sort of pumping your blood. I think that's
Well, like in Scandinavia, they'll take hot sauna and then either roll in the snow or jump in
yes.
the hole
Russians
in a
and
frozen
everything.
lake.
wow, I did
And
not know that. That's cool.
Yeah.
But they just do that. They don't even know that that's like a healing modality. They just do that.
They
yeah,
learned that.
Right. Just something passed down from generations.
Well, and it's kind of goes with what both of you have been saying in that way, is listen to your body. So
Mhm.
if you've discovered something that helps you, that is healing, and listen to your body and your body's needs, and advocate for your body and what you need too,
Absolutely.
definitely.
Yeah. Cool. Now I want to move to Scandinavia.
Yeah.
Maybe go on vacation there. Do
Yeah.
some snow rolling.
Yeah. Well, up next on Speaking in Spoons for this episode, we have Crystal, and she also has chronic pain. And she has developed a blog where she teaches you how to do medical marijuana edibles. So we will talk to her next. And thank you, Diane, for being here. Hi, this is Christina Brookman, and I am your host with Speaking with Spoons. We are back on the pain episode with co-host Dr. Strauss and Lexi. And with us today, we have Crystal Forrest, who we brought on to talk about her journey with pain and where it has led her. So, Crystal, could you tell us a little bit about who you are and why you're here today?
Yeah, my name is Crystal Forrest. I'm a medical cannabis patient in Charleston, West Virginia. I've had multiple surgeries on my knee. I injured myself originally when I was 18 and walked on a floating piece of cartilage in my knee for 8 years. So when they did my reconstructive surgery on my knee, it did not go so well. I had a couple additional surgeries after that, and I'm about a year out of my last surgery, and my knee is just kind of deteriorating away. And my doctors haven't really given me a whole lot of options for treatment for it. So that's why, as soon as medical cannabis came legal, I hopped right on board with it and decided to do that. For most of my surgeries, I was only prescribed Lortab 5. For procedures that normally they would prescribe something a little bit stronger. So that's another reason that I turned to it. So, yeah.
And again, what was the reason? I was having a little trouble hearing you. What was the reason that you couldn't take the narcotic, like the heavier narcotics during your surgeries? Was it an allergy or?
No, it's restrictions in West Virginia. My doctor's only allowed to prescribe at such a high dosage, and for so long, he threatened to cut me off before I had my full range of motion because he was worried about his butt getting chewed out. And I told him, I said, "You do not take it away because I'm trying to get to 135 degrees, and you're telling me if I don't, I'm going to be stuck at 90 degrees. Like, you can't take my tools. I have to do this. You literally gave me a torture device to take home. Like, I need this medication." So,
we were talking about that with our previous guest about because how restrictions have been changing, it's making it harder for the patients that are genuinely just trying to get better and stay better and stuff. And we need to figure out like a some kind of path to that. And tell us about your well, before we get to this, because I know we're going to get into a huge lively discussion, because both Lexi and Nate are so excited that you're here. Can you tell us about, I know you have a rare condition that you shared with us that our viewers would be really interested to hear about.
I'm sorry, you cut out. I didn't hear any of that.
That's okay.
I lost you for a second.
We're having some bandwidth issues with weather and mountains, but that's okay. We'll get through this. What I was saying is, could you had shared with us via email about your rare condition that's contributed to the degeneration in your knees. And I think that would be interesting for our followers. Could you share that with us?
Yeah, so part of the reason that when he went to do the reconstruction surgery that it didn't turn out so well, I got a condition called arthrofibrosis, which is pretty much your immune system is attacking the joint because the joint has experienced too much trauma. So your body just starts attacking it essentially. So that's why I built up a lot more scar tissue, and that's why the arthritis is so aggressive and stuff too. Partially that is from walking on a previous injury, but also I believe I might be genetically dispositioned for it as well, because it was so severe. Like, they have seen cases of arthritis, but mine was really, really, really bad. Like they tell me it's a miracle I can move my knee past 90 degrees.
Wow.
So the fact that I can do that is amazing, but they believe that it's led back from a stressor gene that you develop as a child being through too much trauma, which I am diagnosed with PTSD and anxiety and depression from long-term abuse as a child. The state didn't really take me away until I was about 15 years old, so I dealt with abuse for a long, long time. So I have some crazy stories, but I'm not going to share those today.
That's okay. You don't need to. And you said you've been listening. Were you able to see our trauma episode with Bill? And Beth was talking a lot about the connection, like what you were just talking about, the body mind connection, and like how trauma, and specifically childhood trauma, can trigger some of those conditions, that inflammation, and which is arthritis, exactly what you're saying. So that's fascinating. And so what's the name of, you started this off, I'm so excited about it's, tell us the name of, is it a blog? It's a blog, right?
Yeah, it's Crystal's Chronic Cake Pops. I started it up just to try to help patients that are just starting out and maybe looking for different options or just want to get educated on some things. So I plan on teaching people how to make butter and use edibles and show them the inside of dispensaries if I can. Some of them allow recording, some of them don't. So of course I'll try to be respectful, but yeah, just kind of show the experience of it for maybe somebody who just got a cannabis card and they don't know anything about it,
Right. I think that's amazing. Like, I wish I had come across your site earlier, because I got my cannabis card and I had no idea what to do. I knew I didn't want to smoke because of my lungs. But they there's just so few edible options in the at least here. I don't know what it's like in West Virginia. I've heard if you go to California, like it's like a bakery, but here, so I was having fun looking at so what is your goal, or what is like one of your favorite things to make with edibles that you think is really beneficial and just something people can enjoy?
I really like making the cake balls, honestly, or the cake pops. It's just cake batter rolled up into a ball, and you can do so many different things from it. You can make it from scratch and add in all natural ingredients. Like, You can do a box mix if you want to do that and just add little fun things in it. Like sometimes I'll add little crunch pieces or little organic dehydrated strawberries, and I'll inject them with Cool Whip and just do little fun things with them. So I really
That
enjoy
sounds
doing
awesome.
them. Yeah.
I bet your pictures look amazing. And we're gonna
A lot-
put a link on our website for people to be able to check it out so they can
Yeah.
follow you. Because it's really cool.
A lot of people.
Can I ask a quick question?
Yeah,
When
absolutely.
you decarb the weed, like what temperature do you decarb at and how long do you do it? Because I've been having trouble with that.
You want to do it at a low temperature, usually about 350, 325, something like that, for about 20 minutes.
Okay, I've been doing like 200 for like an hour.
Well, it's definitely decarb by now.
I didn't know you could make butter with it, and then that can go into.
Yeah,
Like, I'm so ignorant in this area.
yeah, that's my next video. Actually, I want to do that and make some butter. I'm actually going to use roaches and do it first, just to show people like a cheap way of doing it, and it still tastes good. You can still
Oh,
do all kinds
roaches,
of
no.
stuff.
Are you,
Not like roaches.
This is how ignorant I am.
are you just infusing it in the butter, or you're making a butter out of like macerated marijuana?
It's yeah. You take the ashes off of it and stuff and clean it up, take the tips out of them. We usually smoke it with the filter, so usually the filter catches a lot of the resin and stuff that comes off of it. And then, yeah, you just grind it up and you decarb it in the oven at a low temperature for about 20 minutes. And then you slow cook it in a crock pot for, on low for like, I want to say like 8 to 16 hours. It just depends on how much you're doing, stuff like that. So it's kind of a slow cooking process, but it infuses it into the coconut oil that you add with it.
Oh, you
and
add,
that's how you-
you add an oil. Yeah, that's an herbal, that's like an herb. We do that with like any herb you can put in the fat and it'll emulsify. And yeah, that's brilliant. Yeah.
Yeah, and there's
Nate's
a bunch.
background is nutrition. Yeah.
Also herbal medicine. So
And herbal, yeah.
I've made tinctures, I've made oil emulsification or infusions and water infusions, and
Yeah,
any menstruum, any medium you can infuse herbs into, because it'll pull like the active ingredients out of those herbs.
yep.
So you're
There's
gonna-
other oils you use too.
Butter.
You don't have to use coconut oil.
No, you don't. You can use any oil.
Yeah, yeah.
Right.
So,
And you
Crystal, how would you say that medical marijuana has benefited you in relationship to pain? Like, how does what is life like without it, and then what is like when you use it?
Yeah, well, if you deal with chronic pain, then you know that dealing with chronic pain is not just the pain, it's dealing with the mental aspect of it too. Sometimes it could be just the wear and tear on your brain, having the same pain in the same area for so long. Like, there's been times that I've actually like hit myself in the head just to try to distract myself from the pain and feel something different. So it's pretty
Mhm.
serious, you know. So I would say the marijuana has definitely helped me with that. It keeps my mood positive and helps me just push through, man, because you know it's rough. It's not easy. You know, a lot of people when they're stressed out, they go home and drink a beer. Well, I can't do that. I go home and smoke a joint.
Yeah.
So
And I love what before we started recording, you said something that I wanted to bring up because I think it was such a wonderful thing you said, and I think such a mission of your blog is that you really want people to start seeing marijuana as medicine.
right. I want people to see it as medication and not as just somebody's just trying to get high, because it's not just to get high, you know. And most honestly, you can get really high off of it, you really can, but if you're being responsible about it and you're doing it right, then it can be used in a proper way. But it's the same thing with narcotics or any other
Yeah.
prescription that's prescribed, you know. As long as you're taking it right, it'll work for you. So
That you just hit the nail. It's all about following her instructions, everything in moderation, you know. So I think that's a beautiful way of looking at it. I'm gonna open the floor, and you guys have already kind of done this, but Nate and Lexi, did you have any questions for Crystal?
I did have a question, but pro tip for the emulsification in oil, you can do it in the sun if you don't want to cook it. On a really hot day, the sun, you do that for, I think, for a certain number of hours. I forget the number of hours, but you leave it in the sun, it'll do the same thing as a crock pot.
Yeah.
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 Oh, but I did want to ask a question about, have you ever made a juice out of the fresh marijuana leaf, like put it in a juicer and drink it?
I haven't personally, but I have friends who have done it like next to me, so I've kind of seen the process.
What do they
but-
think about? What do they think about it? Do they think it's good, or does it
I
still
mean,
look at?
yeah, they
Okay,
usually make it with tea, so yeah, they usually
or
enjoy it.
tea. Okay,
Yeah, because tea is kind of strong, you know, so it'll help mask any kind of leafy or taste that it may have, you know.
okay. Or you could mix it with other teas, I guess.
Yeah.
Yeah, I think that's what you're saying, to mask like the flavor of the marijuana itself. That's
Right.
interesting.
Does it have
Yeah.
a bad taste? I've never eaten, like, I've only ever smoked it. Like, I don't know what it tastes like.
Yeah, I'm glad you asked that, because when I make edibles, you can't really taste it in it. And people ask me, like, is there actually anything in here? I'm like, yeah, there's stuff in there. It's like, it gets cooked off and infused into the batter. So it's infused into all those flavors and you don't necessarily taste it as much. So same thing, if you were to make a juice, you wouldn't really taste it inside of there if you had a good strong
not a
flavor. to
strong
kind of
flavor.
it up.
Chocolate covers it really well.
Chocolate.
Oh yeah.
Can't juice chocolate, but
Peanut butter fudge. Peanut
Not
butter
even
fudge.
dark, like, no sugar, but like, cacao.
yeah. You put some cacao. You can make like a smoothie, like a cacao smoothie.
You
Oh,
can
that
cook,
would be cool.
you can cook with butter too. A lot of people don't realize that. Like you can take a little bit of butter and saute your veggies, or throw a
Oh,
little
like a
bit.
stir fry, like a little stir fry or something like that.
Yeah,
That would be
yeah.
pretty
And
good.
you wouldn't even taste it, but it would give you a little bit of a dose of cannabis or THC, whatever you're trying to get, So there's
Mhm.
multiple options too. That's what I
And
try
in the
to tell.
butter, you wouldn't taste it either, just like the baked goods.
If you ate the butter by itself, you would taste it. But if you
But
mix
if
or
you
cook
cooked with
butter,
it,
you wouldn't taste it as much. You might
Yeah.
get a little light taste of it, but it wouldn't be overpowering.
okay.
Yeah.
And so so smoking, like, they were telling me you can control the dose that you get a little easier than with edibles, but edibles, it can. You share it with us what you think, like the differences you've experienced in edible goods, in like the teas, the tinctures, like the smoking, all of that. Yeah.
Okay, yeah, first off, I want to say that vaping is technically better for your lungs than smoking is, because you're actually vaporizing the plant matter, so you're not inhaling as much of it. So vaping
Okay.
is actually considered better for your lungs.
Isn't vaping it's just water, right? With the
But wasn't there
No.
like companies making it with like vitamin E, and that was causing like popcorn lung or something for a while there?
Yeah,
And I
that's
think
not one of-
California banned, like a lot of the, like California banned like vapes being used that way, which is kind of like set a precedence for all the other states.
Is that a difference though in like vaping tobacco and vaping
Well, tobacco, I
cannabis?
think, is like glucose or glycogen or something like
Okay.
that. And I think they were using vitamin E oil whenever they were doing when they were first making the vape. So I don't know if that's changed or not. So I mean, just
I'm
to
not-
throw out that one little bit.
I'm not talking about doing those. Those are different. That's
Oh,
like
okay.
distillate.
You
have
mean
to
like
walk-
actually vaping it? I'm sorry.
Yeah, no.
I'm sorry.
It's okay. I want to clarify this because a lot of people don't understand the difference. The ones that they put inside those cartridges and the ones that you twist onto the battery and stuff, the disposable ones, they mix stuff into that to make it soluble to burn on those wicks because they use wicks inside the pens. I get something different. I get concentrates, and then I get it's called a dabber. You ever heard
Yeah.
that of a dab or
Okay,
a dabber?
Gabrick. Yeah. Okay.
Yes, that's how you smoke concentrates, which is a
Oh.
lot different than smoking those because there's nothing mixed with it. It's just concentrated weed, and you have to press weed to get the concentrate. Like that's literally how they do it. They just compress a bunch of weed.
I
and
have
make
some right
dabs.
here.
Huh.
There you go.
A friend
Yeah.
gave me some, and I was like, "Oh my god, I've never done it." But I
Yeah.
just did one right before this, so.
So
Yeah.
how would that be different? So you're saying it's better for the lungs. Is it better in the consistency and potency? How, like, what do you think? What have you noticed to be the best in all of that?
So for concentrates, they have to take a bunch of flour and compress it, and they only get a small amount of it's shatter or dab is what they call it. So it's very concentrated. I would say like 1 or 2 hits of a concentrated dab is probably as much as smoking a full joint.
Okay.
Yeah. So
Huh.
you're not having to inhale as much, but you're
As
still
much.
getting as much. Exactly. Yeah.
And then what would you say the difference is between that and edibles, like that you're making?
The edibles is a little bit more of a slow release and it's more of a
Okay.
body high. So when you eat it, your stomach is digesting it. So it's more of like it slowly gets released into your body. It lasts a little bit longer.
Okay.
Sometimes they can be a little bit stronger too if you want them to be strong enough to help you sleep throughout the night.
Oh, okay.
Some of mine are so strong that you can sleep through the night and you'll feel hungover the next morning.
So this
you definitely
really,
get
this
good
helps
sleep.
you a lot with chronic, like the chronic pain. This just
Yeah.
makes it kind of just quiets it. That's
Yeah.
So weed was like, they did a study and it said that it was really great. They saw lots of improvement if you had any kind of neurological pain or if it was like cancer related. So like it
Yes.
really supposedly helps the most in some of the studies I read about it helping neurological, and which is why it's so great for migraines.
Did it say why, or it just said that
I don't right now. My brain. No, I don't remember.
The problem is they really haven't done as many because of the battle with legality and stuff. They haven't really done as many studies like in the scientific
Mhm.
I
community
think most
as
of them have to be
yeah.
done in Europe.
yeah.
Yeah.
Well, the college I work for is actually trying to do a cannabis like program.
Yeah.
Oh,
Like they
So-
exist. It's just they're not going back like decades and decades, which is how
Right,
you get
because it's
the
not because it's outlawed for a long.
yeah. But and like I'm one of the like I tried I think I'm the only person I know that has tried cannabis and it didn't help their pain. And I don't know why. I don't know what's going on there.
Did you use a cream? Did you use
uh,
a cream or a topical?
I used gummies and then I used tincture. So help me understand that. Yeah. She's like, don't do that.
No, because there's so many different strains and there's sativas and indicas, and everybody's different to how they react to stuff. So I really don't recommend starting with that until you get to try different things and see what works the best for you. If you're more of a sativa person, if you're more of an indica person, or more of a hybrid person, because there's quite a few different options. So
Okay.
yeah.
And
So you need
this
to
I
try
would love,
to diversify
can you
your palate.
educate our followers since we are talking about this is medicine? And what are the difference between, what are the different strains, and like what are they better for, like that kind of thing. Like I know with one of my conditions and Lexi's conditions is Ehlers-Danlos, and we also have fibromyalgia, but I know with Ehlers-Danlos we usually, at least with pain medication, that is like pill form and things like that, we usually have a higher pain threshold, and our absorption rate is different, so we'll
Right.
need higher levels.
Right.
So I think that could have been some of my problem too. So, but I know a lot of the people, there are a lot of people listening that are going to know what you were talking about, but there's a lot of people that don't, or like me, like I am a novice and I'd love to know more, so educate us.
Okay, yeah, I'll make it real easy for you. Indica is into couch. That means it's gonna make you sleepy. Sativas are a little bit more uppity. They're not gonna make you sleepy. And hybrids is kind of everything in between. Some of them can be sativa dominant and some of them can be indica dominant.
And
Okay.
indicas normally are the ones that help the most with pain, right? Because they're higher in THC.
Well, there's actually a website called Leafly.
I
and
love
it-
Leafly.
Yes, it'll tell you the strain, it'll tell you all the components and benefits of it, what it'll help with, what it won't help with. One of the ones that I know for sure, White Widow is great for pain, but that's one of the hardest strains to find because they've come out with so many new ones. So, but yeah,
Okay.
Leafly is a great resource for getting on there and just doing some research on some different ones and seeing which ones you think did it not help your pain? Is that what it was? Or did you
It
feel
didn't.
weird after?
I have muscle pain, I have joint pain, and I also have really severe nerve pain, and
Yeah,
they're all
you need,
fighting each other.
yeah, you need a topical so that you can get a real concentrated dose on that area without having to eat or smoke a bunch of stuff to get that benefit. So they make up
Okay.
to like 3,000 milligram creams that you can rub on you. So like
And the
that's
problem is
really,
there's a lot of like pharmacies that sell like, oh, this is a cream that has CBD oil in it, but that's never,
it's not
is, do you still need the THC?
strong. Yeah, it's not usually strong enough. Normally it's like hemp pretty much. It's just like low
Okay.
grade CBD and they just make a crap ton of it to produce a crap ton of creams, you know what I mean? So it's
Yeah.
not really quality controlled or anything like that. It's a little bit different when you go into a dispensary. I recently got to go into one in Michigan and I was blown away at how many products they had up there compared to down here because we really don't have a lot of options because we just
Yeah,
got
we don't
legal.
either. Yeah.
Yeah. So, but
That's,
Michigan, they are blowing it out of the water, man. They had so many options. They had 3 different pain creams. One was like a 500 milligram, they had 1,000 milligram, and then they had a 3,500 milligram. And I was like, that's awesome because we have none here.
yeah.
None. And I'm like, I asked them, I was like, most of the patients coming in here have disabilities or walking devices like me. Like, why do you all not have pain creams? Like, that's crazy. They didn't have
Yeah.
concentrate start now.
What
friend
kills
Jen
me
gave
too
me-
is like, and I guess this comes with the problem of it, the legalization. It for looking at it like medicine, which we are, it really needs to be covered by insurance because a lot of these people too that are coming in with chronic pain, you know, or at least like covered by insurance and definitely by Medicare and Medicaid. Because like when you're on disability and things like that, or you're on state aid or government aid because of your pain condition, you should be allowed to get these medicines like you would any other medicine. Because it's cost prohibitive. Because that was the other thing. I went to the dispensary and it was just so expensive to keep going. And I broke out in a rash, but I've been told, so like I'm allergic to marijuana, and my doctors were like, that's weird, but we'll put it in your thing. And then later people were like, it's probably the fillers or something that was in it.
It's very possible.
Yeah. Do you have any thoughts, like things you wanted to talk about?
Yeah.
Sorry.
Actually, I want to say there are people that do have allergic reactions to weed. So I do know people that like they can only smoke concentrates because the flower makes them sneeze. Or
Oh,
vice
okay.
versa. So
Isn't it hard on your
it is-
kidneys
it
also?
is possible. What?
Isn't marijuana, isn't it filtered out through the kidneys, and so it can be hard on the kidneys?
Everything's
I've
filtered out
never
by
heard
the
that.
kidneys.
Well, that or no, it's filtered out by like either the liver, like drugs are either done by the liver or the kidneys, you know?
Liver detoxes, it doesn't filter. Kidneys filter.
If it's fat soluble, it comes out through the liver, I thought.
It'll go through the liver, but the liver doesn't filter things out. It puts things back in to be filtered out.
Okay.
But it makes them non-toxic.
Okay.
Our body has natural receptors for CBD and THC, so it
That's why
naturally
it
binds
works.
to
Yeah.
it anyway. Exactly.
You're
make
making me want to
make
go to
your own.
Lexi and stuff and your site more and just like look at maybe there could be things that could help me with my
Actually, I was going to tell you, if you ever decide to make butter or you can get a hold of butter, if you rub that directly on your skin, you're probably less likely to have a reaction because it's just coconut oil and marijuana. You know what I mean? There's no
Oh,
extra
that's
scent.
great. Yeah.
And you can
So
make a cream too. You can make a cream at home.
And you're doing an episode on, you should also post something about making a cream.
Yes, I want to do that as well.
Yeah.
Yes.
Yeah.
Yes.
Definitely.
Crystal, you're changing the world.
I've always wanted to help people, and I didn't really know how that was going to work out in my life because I always just worked, you know, paid
Yeah.
bills and worked. Like, how am I ever going to be in a position to help anybody out, you know? It's just odd because it's like I'm finally in a position where maybe I can help somebody out. And it's awesome. It's amazing. So
Yeah, you are. I think you are. So that's great. Any questions or comments anybody has before we wrap up?
I kind of wanted to talk a little bit more about like the medical trauma thing, actually.
Yeah,
Oh
absolutely.
yeah, throw your hat in on that one.
The gaslighting and stuff like that too.
Go for it.
My doctor, honestly, he's one of the best in the area. He's one of the best doctors in the area. But when I went in for my last visit, he's kind of like, well, I can't do another surgery on you, so I don't know what to do for you. And I'm like, well, there's got to be some kind of option for me, you know? So I started doing my own research, and I was like, oh, well, there's aquatic physical therapy. There's, you know, using more of CBD creams. There's emu oil. Have y'all ever heard of emu oil?
No, what is that?
It's another natural substance that you can rub on yourself for pain relief. It helps a lot too, almost as much as the CBD or THC creams do. So
Wow.
yeah, it's another.
So how has pain changed your life? Like, I'm remembering some questions that we asked earlier with Diane, and I'd love to hear how it's different with you, but how has pain changed your life?
Yeah, so I went from working 3 jobs to hiking and biking and being very active to I'm on a crutch now, and it's hard to do even day-to-day tasks, or it's hard every day. I'm in pain all the time. I wake up throughout the night and I have to put a pillow between my leg to sleep on my left side, and I can't really sleep on my right side like too much at all because it's uncomfortable. So yeah, it can be hard for me to sleep sometimes. So that's why I like having the edibles, because that helps me sleep through some of that. You know, I'll wake up and have to put the pillow in there because I can't sleep on that side without doing that, but I go right back to sleep. So I like
That's the worst too, when you can't sleep. You know, sleep is so necessary to get refreshed.
It messes with your mind even more because you're already upset that you're so young and you can't do anything. And the doctors are like, we can't do anything for you. You're stuck like this. And everybody's like, well, why can't they just do a full knee replacement? Well, won't you go sign up for a full knee replacement, bro? You don't understand. like, that's why you're not a doctor.
If you could give advice to anybody out there that is like a loved one, a friend of someone with chronic pain, what would you give them? Or tell them anything? Yeah. Hold on, you frozen.
We are having technical difficulties. Please hold on for one moment.
This is really good advice too.
That I do.
Okay, we can hear you now. Will you pause? So can you go back and see?
Okay.
From the top.
I forgot. I don't know what part did it cut out at?
No, all of it. Yeah.
No.
You started talking and you were so into it, but it was like frozen, and we're like,
oh no. I don't even remember what I just said. Crap.
it's okay. You'll come up with another brilliant one. If you could give advice to a loved one or friends, family out there, or just someone who like is the layman and sees people work, colleagues. Yeah.
Yeah. I'd say definitely listen to the spoons theory that you shared a couple weeks ago, because that's really a great way to explain to somebody what you're going through, especially because I'm young and I have a lot of young friends who don't really understand why I can't keep up or do the same things. A lot of them think I can sit for 5 minutes and I'll be okay. And they don't really understand that it's not like that, So I definitely think the spoon theory definitely helps explain that to people, that I can't keep up with my house the way I used to. I can't keep clean clothes the way I used to. Walmart is a chore. It's a chore. I hate Walmart anymore. And I used to love Walmart.
I just pick up. I just pay for
It changes your
pickup.
whole life. Did it cut out again?
No.
You're good.
Okay.
Lexi was agreeing with you.
Yeah, you gotta just pay for pickup, man. It's so much
Yeah.
easier.
Or delivery. I do everything delivered.
I'm waiting on disability. I'm working, actually. I've been doing estate sales and I resell stuff online. But
yeah.
That's getting really challenging to do too. I've been picking smaller and smaller things, which means less and less profit, which means harder and harder to pay my bills. So
yeah.
I've had a court date that, and hopefully the judge will get the results soon for my last doctor's appointment. And
it's a whole process. Yeah, they always reject the first time, but do not be embarrassed to use assistance in the meantime. Food stamps, whatever you need. And even when you're on it, you'll probably I use
Whatever
food
you
stamps.
qualify for is rather
Yeah.
what.
Actually, I wanted to talk about that too, because West Virginia is running out of funding. And I see people donating to all these bigger places, and I'm like, West Virginia people, wake up. Like, you all need to donate locally, because our charities are out of funding.
Wow.
They're out. Yeah, and most of them will only help you with one bill a year too.
Yeah,
and we only
that's the way it is here. Yeah.
Yeah, when I lived in
with
Virginia,
utilities, you can only get it but you can. There is food stamps. With food stamps, you can get Amazon for $6 a month, and that's the whole United States. And with that, you can get food delivered. It's up to Nate's house, because Amazon can't find Nate's house, or can they?
Yeah, they won't deliver it to me.
So Nate's the only one that can get
no,
it.
wait, they'll deliver packages to me for sure, but they will not deliver food. Food is like, they draw the line there.
Basic sustenance. Yeah. So that is helpful, I found. And then also with utilities, getting it budgeted throughout the year, so you're not surprised with the bills. And then also for internet, which we rely on so much now, even to have medical appointments, like televisits, you can apply, if you're on anything like food stamps or anything like that, you can get internet for cheaper, for $35 a month, and that is really helpful. It started during COVID. It started during COVID. And I forget what it is now, but if I find it, I'll post it, and I'll definitely send it to you, Crystal. But it's very helpful. Because I mean, Wi-Fi needs to be thought of as a utility and a necessity these days in this age, this modern age.
A lot of people work from home.
Yeah, exactly. So if you could give any doctors advice when dealing with chronic patients, what would you say? Or chronic pain patients? That came out wrong.
It's good to listen to your patient, but it's also good to be informed about what your patient is going through. I kind of feel like at times that I know more about my condition than my doctor does. He tries to tell me that the arthrofibrosis will not come back with a full knee replacement, but I know because I've read a bunch of studies on it that it's a very good possibility that it will come back.
Yeah.
More than likely. So I'm looking into some therapeutic outlooks for that, which is still being tested on mice to deal with that stressor gene that I guess I developed as a child going all that trauma. So I definitely worry about the trauma that I'm going through now because, well, I went and got my birth control last week and I've been getting it for a long time. And this time I got tendonitis in my shoulder from it. And I think I might have some inflammation up in my shoulder and maybe all of my joints because of my knee.
Yeah.
I don't know if it's possible. I've never heard of that before, but I'm hoping I can get into a doctor soon. It's so hard to get into doctors around here because we're low on specialists. It's like be a specialist for every body, you know. So my orthopedic doesn't do anything with arthritis. He sends you to a rheumatologist who specializes in
We are having technical difficulties once again.
I'll make a title for this.
Yeah. Well, we need some kind of like, hey, you guys do your 70s theme song right now. That was fun. I don't think she knows.
Crystal, we can't.
Okay, you're back. We just did a theme song. You froze, so we didn't catch any of that.
Oh, okay.
But what I would like to say is you have continually been bringing up this point of the research that you do as a patient. And I think that's something like the three of us have found, other people I talked to have found, and I did not do that in my 20s as much as I should have. Like I did, but I went and I trusted the experts, and that's important. But it's important to get multiple opinions. It's important to research your own condition because they have med school, they have training, all this stuff. They may have half an hour or even 15 minutes on your specific condition. You have a lifetime with it. So do the research. Like I'm having surgery on Monday. And the guy that did it, he was recommended to me through some credible people. So I trusted that, but I should have gotten multiple opinions before I did that surgery, I think. And now he's wanted by the FBI for medical fraud and malpractice. He lied to me about stuff.
I mean, how you? It's not on you because even Cincinnati Hospital was helping him. Like,
no, but it's good to be proactive.
But it's good to protect yourself, you know. And like I learned, that's what I'm saying. If I could help other people from what I learned from this situation, is that just because it's this reputable hospital who's recommending somebody, it's always good to get 3 or 4 opinions and do your own research as well, you know. And even then it still could have happened, but you know, you never know. But I think what you have done, Crystal, is a perfect example of taking this situation and really going, this is what I want my outcome to be. How can I find answers and research? And it doesn't make you a hypochondriac. It doesn't make you.
I'm not taking my degree. I wasn't gonna take 90 degrees as an answer from my doctor. When he told me I was not, he said, you're not gonna move past 90 degrees. He said, you're
Yeah.
not gonna make it past 90 degrees on the bend. And I
Yeah.
said, yeah, I am.
And I will say
That
too, a
was not
disclaimer to
easy.
people out there, we are not medical people, and sometimes there are
Non-medical
cases
people.
where, well, Dr. Strauss is, but
Not that kind of medical.
but there are cases where there are conditions where people are not going to go past 90, and there's that grieving and acceptance you have to go through. But there is nothing wrong with saying, this is what I want, and I want to try everything to achieve that. And I'm not going to just take this, no, you can't do it. I mean, if it gets to the point where, yes, you can't do it, then I have a different thing I have to do. Yeah.
It's better to try and give up than to never have tried at all. Just like it's better
Yeah.
to love and lost than never love at all. It's better to try. It's always better
Exactly.
to try.
Always try.
'Cause you'll regret it. You'll regret it if you don't. Later on, you'll be
Yeah.
like, man, I wish I would have tried harder because now my knee's stuck at 90 degrees. I'm in miserable pain, like in a wheelchair, So
I
it
just want to
was
get a
not
big
easy.
house from Habitat for Humanity and invite all you guys, we all live there, and make a commune for people with chronic illnesses and disabilities, and just, I don't know, do yoga, and Nate can do spiritual stuff, and you and Lexi will do the pain workshops, and Crystal will bake us stuff, and yeah.
We could do a
Crystal will
festival.
teach me how to bake stuff too.
Yeah, and Diane, who we had earlier, she's gonna tend to all the animals, and yeah. And Valerie, yeah, Beth will play the music. It's
I would
great.
like to say something just to reinforce
Yeah.
how much marijuana helps with pain. I've actually only ever used it whenever I have had chronic pain issues. And my chronic pain, like when I was 19, I started and then I stopped. And then, I did that because I had a leaky appendix. When I cracked a rib, I picked up smoking again and then I stopped. And now I'm doing it because of my migraines have gotten out of control. That's how much it helps with pain. One time I was trying to cut carrots, and just CBD alone, because there's so many other cannabinoids other than THC. It doesn't have to be THC to make you feel better. I was having a migraine so bad and paresthesia that I couldn't cut carrots, and I was on the floor crying. And my ex, came and brought me CBD, and within 30 minutes, I had tried every trick, every abortive, every medicine, and that was the only thing that got it going. So I just wanted to say that, because even CBD can help you. I don't know. I know I just ADHD bombed this shit, so I'm sorry.
Oh, that's
No,
good.
it's
I
good.
agree. I agree. And actually, that reminds me, there's also Delta 8, Delta 9, Delta 10, and they're all just different ways that it's extracted from the plant. And the Delta 8, 9, and 10 are legal. So anybody looking for pain relief, you can go get it. You don't have to have a card.
Oh,
Wow.
Crystal, we should just have you on every month, and then we'll learn more things.
You really should, 'cause I feel like I haven't
Crystal's
even.
Corner.
Well, thank you for joining us today. And we look forward to talking to you more in the future. And thank you. I'm gonna sign off. We'll edit the rest. Okay, I'm gonna hit the end of record. That's getting edited. Bye.
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 Hi, this is Speaking in Spoons. And we're just doing a little after party, as Dr. Strauss said it, on our episode with pain. So do you guys have any following up thoughts or reflections on our episode today?
I want Crystal to teach me how to properly make edibles, because I suck at it.
There you go. Well, you and everybody else can go to Crystal's website. We're gonna post it, thank you, on speakingwithspoons.com. It's yeah, and she's gonna teach us a lot of things. I'm really excited about this butter episode. I think that's gonna be great. And
You
Nate
can-
and I had a wonderful conversation with my friend Diane, who's been through horrible surgeries and is now like on a pain pump and stuff.
Oh yeah,
And
that's true.
yeah. So she had some great things to say about finding your breath and like centering yourself and listening to yourself. So I talked about this a little bit earlier with your group, but my surgery is Monday. I'm getting all of the hardware. I had a bad fusion, so I'm getting all of the hardware in my neck removed. Turns out I never needed it. He was telling people that, you know, we were so hypermobile, and I do have Ehlers-Danlos, but that we were so hypermobile that like if we got in a car accident or something, we'd have internal decapitation. It was not going to happen. But also I found out I have a congenital defect where the base of my skull is fused to my first vertebrae. So my head's not going anywhere. And my pain could have been handled in a different, more appropriate way. Like the pain was there, it was legitimate. It just wasn't because my head was going to fall off.
It was an unnecessary surgery that he made you believe was absolutely necessary.
Yes. And he was doing that to lots of people. That's why the FBI raided it. He fled the country to Pakistan. There's a book being made and a movie, The Butcher of Pakistan. And this was up in Ohio, in Cincinnati, and a little in Kentucky, because he was like right on the edge. So it affected a lot of people. And I have had conditions before. I don't know. There's mixed feelings on if this surgery has caused some of my conditions that have come after. So we'll see after the surgery. And I'm going to do some videos to kind of update you guys and go through the crazy process, because I don't think everybody really knows what some of us go through out there going through like a major surgery, how it affects us as the patient and the people around us that are having to advocate for us and are scared, you know.
We really need a caretaker episode.
We're having a caretaker.
And we
episode.
have a kid. We are gonna do one. Yeah.
Yeah, we're gonna
really
interview
were.
caretakers and loved ones. And our next episode is actually going to be about relationships.
Oh,
Oh yeah.
Yeah. So we're
Okay.
gonna have lots to talk about.
Maybe.
yeah. Let me think about everything I want to censor in my life.
This actually podcast kind of got started because when Nate and I started doing like choosing to go back into the dating world, and we were doing online dating, we were like, we should do a podcast called Dating Disabled or something.
Oh yeah.
And then like we've been talking about that for years, and then and then Speaking with Spoons happened. So
Well,
this
yeah, but not focused on just the dating, which is
well, exactly, because there's so much to talk about. Thank you for listening to us, and we look forward. I'll be in touch about the surgery, and we look forward to following us on our next upcoming episode about relationships.
If you want to contact us, please send a DM or an email to speakingatspoons@gmail.com with any stories you have, or if you'd like to interview with us on any of our upcoming topics. Thank you for listening to Speaking in Spoons, and have a great day.